Okay, so doing posterior teeth, let's start with doing the distals. So if you were to think about what kind of shank would you use for the distal of the posteriors, hopefully you're thinking about more of a complex shank with bends in two planes, so front to back and side to side. So then you'll want, if we're doing the distals, not only a complex shank, but one of our bendiest instruments. So if you just look at all the shanks, I bet you could narrow it down to the most bendy instruments would be a 13-14 or a 15-16. And if you'll look at both of them, they're the exact same design, except for the cutting edge is just on the opposite sides. So the 15-16 would be for mesials, but the 13-14 is for distals. So try and find the 13-14. So, and when we're first practicing, pick your easiest tooth. So something for righty clinicians on the lower right, and for our lefties, choose something simpler on the lower left. So we'll pick our 13-14. We're going to determine the correct end, and it's the same procedure. Have the toe towards you at your eye level. Look at it straight on. Have your terminal shank, the last bend in the shank, absolutely perfectly perpendicular to the floor, and determine which is the lower edge, and that is the cutting edge. So find that cutting edge and then hold it to the tooth surface that you're choosing to do. So we'll be going on the distal, start at the distal buccal line angle, and you'll be going distally, just like you would with the Explorer. So things you can do, you can check the face, make sure it's tilted towards the tooth. You're going to keep your toe third adapted. You want to make sure you have a beautiful grasp and fulcrum. And sometimes we need to pivot slightly to get to make the instrument more parallel. If it's slightly across the tooth, pivot on your fulcrum and see if that helps. If it doesn't, and you can't get your instrument parallel, consider you have chosen the wrong end. So you will insert at the distal line angle, make your proper angulation. We want to be perfectly parallel between 60 and 80 degrees. So that terminal shank should be nice to the tooth. And you're going to activate your exploratory stroke. On this one, if you feel any calculus, activate calculus, a calculus removal stroke, or try and just add a little lateral pressure. And if there's no calculus, you'll just scrape a little bit of the tooth, and it's on the typodont, so we don't have to worry about hurting the typodont. And then you're going to continue to adapt and roll the instrument and go all the way into proximally. We only have to go halfway. You want to make sure you come up into the contact area, right on the under the contact area, and that you overlap the whole tooth. So, and you want to make sure that you're activating these strokes with a wrist rock. You want to make sure you're not fulcruming on the same tooth you're working on. And you want to make sure you have a beautiful grasp. You're adapting the toe third. And you're using those channeling strokes. And you keep the toe adapted all the way to the contact area. I'll play that one more time for you. And if you've had enough, you can always just skip it and move on. So when you first start, your toe third has to be on the distal buccal in this situation. The distal buccal line angle, see how my whole instrument's here? But that's not the part that's working. The only part that is that toe third. Okay, so to do the mesials, now we're going to have to change instruments. So to do the mesials, let's start, you have a choice. You could do the 11-12 or a 15-16. If you're going to do a premolar, you might prefer the 11-12. If you're doing the mesial of a molar, you might prefer the 15-16. And if you contrast and compare the difference, the 15-16 has a little more bend, and that's why people tend to like it the further back you go. I'm a righty clinician, and I tend to really like it for the lower left. Lefties might prefer it too on the lower right. Your preference for which instrument will depend what type of fulcrum you use in the future. Right now we're focusing on intraoral fulcrums, but when we teach you extraoral fulcrums, you'll notice some patterns. Extraoral fulcrums usually work better for 11-12s. 15-16 are better with intraorals. Okay, so basically we need to start where we left off on, right? So we want our toe third on the distal buccal line angle in this case, and it would be the same thing on the lingual, distal lingual line angle, with a more oblique direction, which is slightly diagonal, and then you're going to come all the way in and turn it to a more vertical once you seat your instrument. And the same concepts, you have to determine the correct end, have the toe to you, get your terminal shank perfectly perpendicular to the floor, and then the lower edge is the cutting edge. Now, so many times students will try and memorize the number or make these crazy rules. And when you make up crazy rules, they don't always work. It depends what instrument's in your hand. So I like to remember rules that always work instead of little nuances to them. So this way, with the toe to you, always works. And then with time, you won't have to stare at the instrument and do this. It will definitely become more fluid in a couple of months, but you've got to keep practicing. And if you don't have the basics, you can't go to the next step, right? Okay. So we're starting at the line angle. Actually, I'll just show. So I'm inserting, and I know you might want to be starting. I happen to be doing the patient's upper left buccal, but if you're doing this for the first time, do the lower right. And we can flip back the cheeks when you're first starting. It's okay to cheat. As soon as we get into clinic and practice doing this, though, we'll want to flip those cheeks back and make sure we're combining our instruments with our mirror and make sure we're developing very good mirror skills. Excuse me. So we're starting at the distal buccal line angle, overlapping strokes, and as we come to the mesial, yeah, the whiteout is a little sticky. So then as you come mesially, you have to make sure you're doing more of a vertical stroke. You don't want to still be at that diagonal because you'll be missing something, either the most apical component of the sulcus or underneath the contact area. So you can see I did my strokes, my working stroke, and ended right in the contact area. This is just a slide showing you a 11-12 versus a 15-16. On this, the clinician is fulcruming, and they're kind of lying low on their fulcrum, and you might not be able to tell this, but they're lying a little low, whereas to get an 11-12 parallel, especially so deeply, they need to stand straight, tall, so that they can make sure that their terminal shank is perfectly parallel to have that effective 60 to 80 degrees with the face to the tooth surface. So this is just showing you some subtle differences. And once you do, keep using your Curets over time, you'll start to see these subtle differences, and you'll be creating your own preferences.